Good morning, ladies and gentlemen. Welcome to the first session of the National CARES Act Training Conference. This morning's session will focus on challenges and potential response activities for rural communities as they respond to the impacts of the COVID-19 pandemic. Next slide. This morning's agenda, we will first look at unique challenges faced in rural communities, and we will address the following specific eligible activities, addressing the impacts in housing and housing instability, access to food, broadband and Wi-Fi access, as well as economic development and recovery in rural communities. We will, of course, follow up with a question and answer session. Next slide. My name is Eric Chatham. I'm a consultant working with NowCab, the National Association of Latino Community Asset Builders. I'll be one of your presenters this morning, along with Stan Fitterman, also on screen this morning. Good morning, Stan. We have Mario Gell with NowCab as well, helping us with the technical, manning the slides. And we have several staff members to help us with questions from HUD, including Diane Schmoltzel, Corey Schwartz, and Mr. Robert Peterson. Thank you all for attending. So I'd like to start with addressing or reviewing some of the unique challenges we've witnessed in rural communities as they address the impacts and begin to recover from the impacts of the COVID-19 pandemic. So in rural regions, we tend to see higher levels of poverty, leading to fewer job opportunities, which is certainly stagnating the ability to recover financially and economically. And as we've seen and witnessed with this extended pandemic, there's heightened vulnerability to labor market shocks. Again, rural communities are having a much harder time recovering financially. Rural areas broadly have lack of access to healthcare. Certainly, healthcare facilities are more widely dispersed, and so access, prompt and easy access to health clinics has been limited and an ongoing challenge in rural communities. We've seen through the pandemic increased reliance on telehealth. Of course, that is reliant on access to good cell phone service or broadband access. We tend to see older populations and more higher rates of health compromised populations in our rural communities. And we've seen serious barriers to enrollment in clinical trials with COVID and access to vaccines at this point. And far more limited access to COVID-19 testing. And again, at this point, vaccines as well. Some of the unique challenges that states and rural communities are having as it relates to utilizing CDBG and CARES Act funding is, of course, in our rural communities, we have fewer grantees. So we have limited access and limited subrecipient capacity to deliver what might otherwise be eligible activities. There just may not be capacity to deliver these in a meaningful way. Of course, dispersed population in rural markets makes it a little more difficult to deliver and offer services. And as we mentioned, and we were seeing throughout the pandemic, a heightened need for access to broadband and internet access. And so their lack of quality broadband and widespread internet access make all kinds of online applications for assistance and online coordination of these programs much more difficult. At this point, I'll turn it over to Stan to address some of the housing impacts of COVID-19.
All right, thank you, Eric. If we could, there we go. Thank you, Mario. So in CDBG, we've always had the ability to make emergency payments for up to 3 consecutive months. In my experience, not many of us were doing that. It has started, of course, now with COVID-19 to be much more popular activity. HUD extended through their waiver in the Federal Register notice to now where we can pay for up to 6 consecutive months. And one important thing to remember is that consecutive months start when you make the first payment, So if you're making payments for someone who was in arrears for 4 months, when you make the payment, that's starting with the that's the first payment. So then you can do 5 more months after that. And there was recently, actually it was in March 30th, there was a FAQ published. It's on the HUD Exchange under the CDBG-CV section that explains how you can do the that how the 6 consecutive months is determined. Provides more details on that. And what we've seen in CDBG-CV housing assistance programs for rural areas is they're often either administered by state, or you're administered by state grantees. Some states allocate the money to cities and counties for implementation to be done at the local level. We've also seen situations where states have had nonprofits that are based in some of the more rural areas, such as community action agencies, which are fairly well distributed even in the more rural areas, to assist with the application process. All right. So what can emergency assistance payments cover? Well, rental assistance, which was popular until the Treasury program came out. Now folks tend to be using the Treasury program for rental assistance and emergency payments for CDBG, more focused on mortgage assistance. They can also be used to pay utility assistance. We've always had to make the payments directly to the provider. So it has to be to the landlord or the mortgage servicer or the utility company. HUD has written special rules if the utility company is a public utility. So if you Google that or go to HUD Exchange, you'll find those, how to handle it if it's a public utility. In rural areas, we tend to see more folks have contracts for deeds as opposed to have a warranty deed for their property. So with a contract for deed, you don't really own it, so you make the last payment. Those are still eligible for assistance. HUD recommends, does not require, that the contract for deed be properly recorded and serviced by a third party, or otherwise provide some protections for the buyer, because often those have been things that folks have unfortunately taken advantage of people with. Okay. All right, so I think we covered this. They're made directly to the provider. So we've got to be able to confirm that the payments are properly applied, that the intended benefit was received, especially if we've got less conventional real estate agreements involved. We need to be on the lookout there for fraud, waste, and abuse on these as always. Utility payments are eligible public service activity. Again, when, as I mentioned, when it's a public utility, there are special rules that HUD has provided us with. Okay. Applications, in our experience, we've been doing a lot of the AAQ Ask a Question desk, and a lot of the applications are submitted electronically via third-party platform. Y'all have probably heard of Neighborly, Zoom grants. There are various other ones that are out there that people are using to accept applications from electronic. Given the limits on internet access, and sometimes also given some of the age of the folks that need assistance, local states have enlisted local community action agencies or other nonprofits, as I mentioned earlier, to accept the applications, help folks apply, answer questions, and also provide them with internet access for those that don't have it. And this would be an activity delivery cost. We've got to consider duplication of benefits. One thing I want to make sure folks understand is that it occurs when two sources pay for the same need, such as two different agencies making the rent payment both for March or both for July. If two sources provide rental assistance for different months, that's not a duplication of benefits. So if someone provided assistance for June and CDBG is applying it for July, that is not a DOB, not a duplication of benefits. Okay. So in May, HUD issued a quick guide on, or I believe it was an FAQ, on rehab efforts. Actually, I think it was in the quick guide on tieback. And this allows us, this clarified for us that grantees, we can use CDBG and CDBG-CV for owner-occupied rehab and for rental-occupied rehab. We would want to focus on the things that have result in poor post-COVID health outcomes, such as mold, lead-based paint, poor ventilation through the HVAC system. But it also goes on to let us know too that we can do things that are also required by code. So we can use these funds to do rehab to improve the health out. The tieback is we're going to improve the post-COVID health outcome. So this, of course, can be forgivable loans. And as I noted, we can do rental occupied housing as well. And as it says here, to bring things up to standard building codes and to be consistent with public health advice. So motels acquisition for a long-term homeless non-congregate shelter. So we can go on to the next one, Mario. So California has really been one of the leaders on this, and I was extremely impressed to see during the chat while we were getting started that some folks are either extremely early birds in here from California or never went to bed last night. So, but in California, some of you may have heard of this. It's called a Project Home Key, and they provided funds, I believe it was initially CARES Act funds, to buy roadside motels to be able to house the homeless and to get folks out of congregate homeless shelters. California is not the only one. King County, Washington, which is Seattle, also did it. In California, there's a lot of rural areas that took access to this money as well and bought the roadside motels. It is either a public facility or a housing activity. So the one I'm familiar with California, so from the public facility side, those are the interim. So there are folks who are doing 90-day stays, for instance, to help folks get off the street, kind of get their life together a little bit, and then be able to move into something hopefully that's more long-term. Others are already at having leases and it being permanent housing for from the hotel acquisitions. Davis-Bacon, is required, usually often triggered by this work. So we need to be mindful of that. In California, they have right now an open application for CDBG-CV funds in conjunction with this Home Key program in order to have folks have access to the money to be able to finish rehab. California's approach seemed to have been, let's buy all these hotels as fast as we can. We'll worry about operating and getting them repaired with the next wave of money. This is that it does seem to be quite effective. A King County study, and Mary, if you could go back for a second, county study showed that folks that moved into the hotel rooms had a lower incidence of bad health outcomes, lower transmission of coronavirus, but also had improved physical and mental health, and started planning for the future, and more folks were starting to plan for getting into their own permanent rental housing. All right, it looks like we have a couple of questions. I haven't been paying too close attention to the question box, but are there some, Diane, we should cover?
Sure, yeah, there's a few good questions that have come in. The first one, let's start with, can families who receive ERAP, Emergency Rental Assistance Program funds, also utilize the CDBG-CV funds?
As long as you're paying attention and there's not a duplication of benefits, then yes. So if ERAP is paying for the exact same months and someone comes to you to apply, for back from March, April, May, and June, and they're applying to you for the same months, that's a duplication of benefits and would not be permitted. If their ERAP eligibility has ended and you are picking up from there, or more likely they received CDBG-CV funds from you and are now applying for ERAP, that's not a problem. It's only a problem if you're paying for the same thing twice.
Great. Okay. Another question is, can you use ESG-CV for purchase and CDBG-CV for rehab?
CDBG for purchase, so down payment assistance using CDBG-CV.
ESG for purchase.
ESG for purchase.
I
Yes.
think this must be for shelter acquisition.
ESG-CV. Go ahead.
Yes, so ESG-CV can't be used for permanent housing, but it can be used to acquire temporary housing, as well as shelters, and some of the CV waivers allowed for increased use of ESG-CV for acquisition. Historically, ESG was not used for acquisition, but with CV, there's waivers that allow for up to 2.5 million for purchase. So when you commingle funds between ESG and CDBG, the ultimate end use has to be eligible for both programs. So in this case, I assume, again, you're talking of the question is about some temporary housing or a shelter. So yes, that would be eligible under ESG-CV, and then rehabilitating a public facility under Cdbg-cv would also be eligible. Of course, you need to document the beneficiaries and the national objective for both programs.
Great. Thank you, Eric. Related to that question, there's another one about renovations, so somewhat related. If you're using Cdbg-cv for COVID-related renovations, can the funds also be used to correct code violations? For example, if the front porch is in terrible condition, can Cdbg-cv also be used to make necessary repairs to bring the property up to code compliance?
So yes, so the guide that came out in May that is on the tieback, it's a tieback quick guide. It specifically states that you can use the funds for rehabilitating the housing to comport with standard building codes and public health advice. So yes, you can bring up to use the money in addition to the lead, HVAC repairs and ventilation. You can also use it to make the home bring it up to standard building code.
Great. And then I just have one more question for now, kind of going back to what we discussed a little bit earlier with the emergency payments is, do lead-based paint rules apply to 6-month subsistence payments?
So the best explanation for that is in the FAQ on providing emergency assistance. And the clock, if you go longer than 100 days, then the lead-based paint regulations, Part K, kicks in for visual inspections, remembering that the clock doesn't start when their arrearage is started. The clock starts when you start making the payments. So if you paid for 3 months of someone's arrearages and 3 months forward, you're at 90 days, not at 100. It doesn't count 180 days. So you have to, if you go past the 100 days, so you paid someone's assistance for 6 months forward, when you get to day 100, you are required to do a visual inspection if it's built prior to 1978. In those cases, that has also provided guidance that the visual inspection can be remote as long as you have policies in place to say how that's going to work. Who's going to walk around holding the phone so you can see the walls, and what the skill set is. Making sure the person who's doing looking at the video is properly certified to do the visual inspections.
Great. So we have some more questions coming in, but I'm going to gather those together, and I just think we probably should get back to the presentation, and we can save some more for the end.
Sounds great. Thank you, Diane.
Okay. So rest assured, we're pulling them together.
Thank you, Stan, and thank you, Diane. And just a quick point of reference for our attendees. I see many of you typing the questions in the chat feature, and because so many of you are typing there, we're kind of losing track of that. If you have access and can do so, please type your questions in the Q&A, and then those are a little easier for us to identify and hold on to so they don't get lost in all the comments. Thank you. Moving forward to food insecurity, and similar to the housing strategy Stan referenced, food banks and providing food assistance has always been eligible under CDBG, but during the pandemic and certainly in our rural communities, we've seen increase in food security throughout the country, and certainly with many of our schools going to remote schooling, children that usually are accessing food or getting food through their schools no longer having access to food throughout the day. So we've seen an increased need for various food banks and a lot of grantees doing food assistance type programs that have not otherwise done so. So we're going to address a few scenarios and eligible options here for food insecurity. So the biggest issue that I think many grantees are facing as they try to provide for a food bank is how do you meet a national objective? And so, of course, I suppose the easiest way is if you have your service area is primarily low to moderate income, and then you're able to use the low mod area national objective. However, if your service area is not low mod, or it's harder to define that particular service area, then you may have to use limited clientele. Please be advised, or please note that when you do limited clientele public services, you're able to use self-certification of income and eligibility for those services. So we've seen a lot of grantees that have simplified the application or participation qualification process. And I'm going to highlight a couple options here in the next couple slides. So several school districts in rural Kentucky created grab and go services or sites for families to pick up meals. And we've witnessed that. I'm in South Carolina. We've witnessed that in several districts here as well. And those programs are designed for families that are already qualifying for free and reduced lunch programs. And so by proxy, if you will, we're able to document the LMI eligibility of those participants. Again, school districts or schools that serve low to moderate income areas can still use that low mod area national objective. And again, just a reminder, grantees can use self-certification to reduce administrative burden. And we saw throughout the pandemic, certainly when we were sort of in shutdown mode, we saw a lot of drive-through food pantries. And some of the ideas that jurisdictions came up with so that you're not trying to have people fill out applications in line is to do online or pre-qualification, if you will, where the beneficiaries or participant families would receive some sort of certificate. We saw in some cases, again, this relies on access to Wi-Fi and good cellular service, but QR codes being sent to cell phones. And as you drove through the line, you could either pass over your certificate or your ticket, or a QR code could be scanned, again, to try to limit the backlog of these drive-through food pantries. Next slide. We also saw in Lakewood, Minnesota, rural Minnesota, where the health systems helped out here with providing fresh frozen microwave meals to adult patients, certainly as recovering from surgery, so that as they go home, they would have access to meals and providing them. And as frozen microwave meals allowed them to provide those food in bulk, so they could provide them for a week or longer at a time. We've also seen an increase in programs, or an increased interest in programs like Meals on Wheels. So again, the national objective of LMC would probably be most likely here for programs like Meals on Wheels, where there may be a presumed benefit class where you have either elderly or severely disabled adults that are not able to get out, or again, due to COVID, they high vulnerability or high risk patients might not want to be out, might not be safe for them to go out to the grocery stores. So the Meals on Wheels programs and other delivery services were helpful. And again, the most likely national objective there would be LMC, but if possible, you could do LMA, which would, of course, simplify the intake process. With that, I'll turn it over to Stan to do an overview of the broadband section.
All right, Diane, can we do broadband, or should we take questions?
I think you can keep going.
Okay, great. So at 11:20 tomorrow, there'll be a session exclusively on broadband. So I'm just going to hit the highlights here. And to learn more, you've got an hour tomorrow, tomorrow morning. So we're talking about always on high-speed internet connections. Obviously, we get access to a wide variety of resources, services, products, online school, conferences like this, telehealth, and broadband access does help bridge gaps in education, services, employment opportunities, since people are starting to realize that perhaps they don't, businesses are starting to realize perhaps they don't need to rent an office park. And so, it's important, it is something that we have an opportunity with CDBG-CV to increase the reach of broadband. All right. So with CDBG-CV funds, we can install the actual wiring. In West Virginia, rather, has been doing a lot of this, of using CDBG to install the wiring and the fiber optic cables in order to expand the reach of broadband. We can also, install it in public facilities. We're going to see an example of that in a moment. And improvements, including infrastructure improvements, are also eligible. So, couple of examples quickly, and then, like I said, tomorrow you can get a lot more samples of how these work. Jackson, Michigan, which Jackson County, Michigan, they do have an entitlement city in Jackson County, but a lot of the area is rural, and about over a third of the students in the rural areas didn't have access to internet. You can imagine how that was a problem when schools were going all virtual. So the school district deployed 13 school buses equipped with Wi-Fi to certain parts of the district, and folks who were within 300 feet of the buses were able to access Wi-Fi. This could meet an LMA national objective, depending on where the buses were parked. It could be an LMC national objective if the grantee documented the nature location of the activity, where 50% of the users would be more to be income qualified, or if they provided passwords to households that provided an income self-certification. I thought this was just kind of a cool idea of parking, taking your school buses you're not using, equipping them with Wi-Fi, parking them where a lot of kids don't have access to Wi-Fi. Escambia County, Florida, which is Pensacola, so in the Panhandle, almost to Alabama, they put installed Wi-Fi at their county parks and community centers, primarily to provide virtual learners with access to Wi-Fi. They then expanded it to provide access to folks in more rural areas of the county who didn't have nearby community centers. They used CARE Act funds to do this, but it could have been CDBG-CV eligible as well, and would meet an LMA national objective if you're in an area that's more than 51% or more low mod. And it's an expansion of a public service, so we've got a CDBG-CV eligible expense as well. All right, I think that's it for the broadband. Like I said, tomorrow, 11:20, a full hour on broadband. And I will turn it back over to Eric unless Diane wants to jump in yet.
Sure. I actually would like to jump in. There's a couple of questions we just covered with the food banks. Some hopefully fairly straightforward ones. One being what reporting is required for food assistance, such as purchasing bulk food for food banks?
Yes, so if you're thinking about what your IDIS requirements are going to be for a food bank's always going to be, well, the actual delivery of the food is going to be a public service. So you're typically going to need, if you're using the area benefit, LMA national objective, then you're going to be utilizing the census information as typical with any LMA. So that information is calculated there right for you in IDIS. So it's fairly straightforward. If you're using the LMC national objective, as with any other public service, you'll need the race, ethnicity, and income for your beneficiaries, and at least 51% of the beneficiaries would need to be LMI for the activity to be to meet that national objective. So again, reminder that you can use self-certification there. So you could keep that fairly simple for food bank type activities.
Great. We have another question on food banks. How can procurement be performed for food banks?
Yes, so typically, I believe the procurement question is about the acquisition of the food, not the acquisition or the solicitation of a provider, but let's just be sure. If the food bank is a local nonprofit organization that might qualify as a subrecipient, you would not necessarily have to procure, the grantee would not have to procure the food bank. And so my assumption is the question is about procurement by the food bank when they're acquiring the food. So typically this would fall below acquisition or purchase thresholds, but certainly many food banks are able to work with statewide food bank and food service programs to access food that has been acquired or purchased in bulk processes. Many states have food bank sort of coalitions, if you will, that are acquiring food in bulk. If that's not the case locally and the food bank is having to purchase food itself, then yes, you would need to follow procurement guidelines and get quotes from hopefully wholesalers. Hopefully you're not really walking into grocery stores acquiring food.
Okay, and I have another question. Can we provide gift cards to families for meals, to purchase meals if they applied and proved eligibility?
Stan, you want to address that? I know we've had that several times on AAQ.
It's really hard to do that. Part of the reason is that there is a secondary market for gift cards. You're not going to be sure that they actually paid for food, which is what which is eligible. And I believe, I don't know if there's been formal guidance. I know on AAQ, the standard answer is that no, they're not permitted. I don't know if anyone else on any of our head colleagues have any further information on the official guidance, but I know it's a tough one to make work.
I'll just add that we've seen this question come up quite a bit in the AAQ, and we saw a lot of jurisdictions that use CRF funds last year and passed out gift cards. But keep in mind those other sources of funds coming out of the CARES Act and now the American Recovery Act did not have to meet CDBG eligibility and national objective criteria. So while you might see people doing food gift cards, hopefully they're not using CDBG funds for that.
Yep. Thanks, Stan and Eric. I think you covered that one pretty well. If you can't track it, it can be used for other reasons. One more question on food banks, and then for the sake of time, we can keep going. If they're using, the grantees using area eligibility, what is the methodology for capturing demographics information?
For food banks, if you're using the low mod area national objective, then you'll utilize the census information. And so when you set that activity up in IDIS and select the national objective of LMA, the system will prompt you to enter the census tract and block group information for the service area. So it's important to accurately define your service area, and then you identify census tract and block groups within that service area. IDIS then will generate the beneficiaries. And so you actually, when you use the low mod area national objective, you get total beneficiaries and total low mod population. And you don't need that specific demographic for all the participants, i.e. race, ethnicity, and income for particular participants.
And HUD has a really good mapping tool. It's called LMI, low mod income, S as in Sam, D as in district database. And there's a mapping tool there that you can draw in your service area, and it'll automatically shape it to cover census geography, which is what we get to round up to. And then you can export the census data to a CSV file, which is basically Excel. You can add up the numbers and see what the percentage of the service area, whether it's low mod, but it's a very handy tool.
Absolutely. Thank you, Stan.
Okay. You guys want to return to the presentation? I'm still sorting through some questions.
Thank you, Diane.
I think you're up.
So at this point, I will address economic development and recovery. Again, as we've mentioned, Economic development or direct financial assistance to for-profit businesses and micro enterprise has always been CDBG eligible. We saw an increased need or increased interest in these types of programs during the pandemic. And now that we're trying to recover from the pandemic, we're seeing supply chain cost and supplies really being much more expensive than pre-COVID, and seeing many businesses struggle with getting back to pre-COVID operations. So in short, CDBG funds and now Cdbg-CV funds can be used for what's in the regulations called special economic development activities. And this is where you're providing direct financial assistance to businesses and micro enterprise in the form of operating capital. So that working capital can be used to improve their facility safety. Keep in mind, if you're doing true construction of facility improvements, there might be some cross-cutting regulations like Davis-Bacon in Section 3 that come into play. But in most cases, we've seen this as operating costs such as payroll, rent, utilities, and supplies. Next slide. So a few examples of some economic development activities. State of Nebraska, the Office of Economic Development is offering loans and grants to businesses under these two types of activities. So again, here we're talking about the national objective being low-mod job, where either jobs are created or retained. So funding assistance for new businesses or business expansion to create low-mod jobs and manufacture medical supplies necessary to respond to infectious disease. So we saw this at the onset of the pandemic last year. And now we're seeing increased use for smaller businesses where funding assistance provided to avoid job loss, job retention, while businesses may be shut down or in limited capacity during social distancing. These forms of assistance for small businesses have been in the form of short-term working capital. We've seen a lot of grantees providing assistance for anywhere between 1 month and 3 months. That's not to say that that's the limit, but that's been pretty popular throughout the pandemic and now the recovery. Again, the national objective being there as well, retention of jobs held by LMI individuals. Next slide. A couple other examples. The state of Vermont is offering sole proprietor stabilization program, as they call it, grants from as little as $1,500 up to $10,000 for sole proprietors in Vermont for eligible expenses like rent, utilities, supplies, and inventory. We've seen through our work, working with grantees throughout the country over the last year and a half now, that the smaller businesses, the micro enterprises, which is 5 or fewer employees, including the owner, and in Vermont's case, even sole proprietors, those are the businesses that were less likely to access the various SBA programs, the Paycheck Protection Programs, et cetera. And so these small operating capital grants, and in some cases they are repayable loans, have been really beneficial to these smaller businesses that lack capacity elsewhere to access funding from banks or, again, the SBA programs. Next slide. Another way you can meet a national objective is by assisting retail-oriented businesses and restaurants that are in low-mod areas. And so in this case, the low-mod area, the businesses are providing economic opportunity throughout the area. We've seen a client of ours in St. Cloud, Florida, which is a little south of Orlando, in their downtown entertainment district, as they refer to it. They're providing financial assistance to businesses to acquire and install outdoor dining furniture so that they can, of course, provide for social distancing and expand outdoor dining opportunities. This obviously allows for the businesses to reopen at greater capacity while still maintaining social distancing protocols. Next slide. And with that, quick highlights there on economic development. As Stan mentioned, with the broadband, there's also previous webinars that dive much more in detail about economic development activities, and encourage you, if you're interested in learning more about that, to look at the HUD Exchange and view those previously recorded webinars. With that, I'll turn it back over to Diane for question and answer.
Before Diane starts,
Sorry, go ahead.
I put the link to the mapping tool in the chat, as many of you had requested. It is currently the last item in the chat box, so it should be easy to find. My only complaint about the mapping tool is that when you get to the page where the link drops you off the kind of opening page, you click on view application is how you get to the map. I just don't like that because it's like, to me, not very intuitive. So upper right corner, it says view application. That's how you get to the map. Then you can enter an address and it'll take you to wherever that address is on the map. You can do a base map of streets. You can zoom in and you can use the tool to draw in your service area and export the data. All right. Thank you, Diane.
Okay, so let's see how we can sort through all of these. So we've got a lot of the questions about the mapping tool. Let's see. Here's a question for related to economic development. Small businesses are having trouble finding workers using the bonus incentives to hire. Are the bonuses eligible for payroll expenses?
I think the question would be that they would be necessary and reasonable, and that would be where the grantee would need to. So again, if you're having staffing shortages and you want to do a sign-on bonus, there would need to be some determination that it was, number one, necessary, and that number two, it was a reasonable payment. $50,000 sign-on bonus for a minimum wage job would not seem reasonable. So I think that would rely on the grantee to establish some protocols for what would be necessary and reasonable. Stan, any thoughts on that?
No, but I think also you've kind of hit it. If it's in a industry in your community where you can verify the shortage of employees and verify that this is the amount people are paying, that's how you would do the necessary and reasonable amount.
Okay, great. We have another question for economic development directly related to the presentation. For the Vermont and Orlando examples provided under ED, did they award to units of local government or are the states directly administering?
In Vermont, the state is running that program directly. In St. Cloud, St. Cloud is a small CDBG grantee, and so they are administering that program directly. And in Nebraska, the program I mentioned there, the state is administering that program directly.
Okay. We have some questions on utility payments. Since the cap to utility assistance is $2,000, can that be made as a one-time payment to the utility agency instead of monthly payments? They're citing because they're short-staffed to be able to do that. A little less work.
If you're paying in advance, you're running up against necessary and reasonable issues. Because if someone moves and you pay in advance and then they move, then you would have to set up a system where you'd go to the utility, where the utility would repay you for any money paid for someone that didn't incur a cost. Also, utilities usually vary from month to month, so I think it would be hard to figure out what you're paying for if you tried to pay all in bulk. But I think the big issue that we've run into with people trying to pay one check in advance is the necessary and reasonable part of 2 CFR Part 200 that applies to all federal money.
Stan, can you address the question also said that there was a cap to utility assistance at $2,000?
Is that a local, maybe a local cap?
Yeah, that's what
Yeah, because the HUD caps are the 6 consecutive months and making sure the payment are in that 6 consecutive month time. So that must be a local amount, local determination.
Exactly.
And I think that would cause you other problems of paying in advance. If you paid a $2,000 and someone didn't spend that much, incur that much of utility payment during the 6-month eligibility period. It has a lot of problems.
Okay. Thank you for that. Another utility payment type question. If a resident is getting partial assistance for a utility, can the resident still receive utility assistance from the Cdbgcv program for the unpaid amount?
faded out for a second there. They're getting a
Oh, sorry.
partial payment from another source? Is that?
So they're getting
question?
partial payment for a utility. Can the resident still receive the utility assistance from CDBG-CV for the unpaid amount?
For the unpaid amount, yes. And I would imagine this would be a situation where there are arrearages and someone's getting paid for paying a portion of the arrearages. You could pay the remaining portion of the arrearage, make sure the file is documented to show what came from another source, and making sure it's very clear from a paper trail that you didn't pay for the same thing twice
Right,
that someone else paid for.
right.
And Stan, related to that, can you address how the 6 consecutive months are calculated? I know you talked about when the 100 days starts. You can talk about the consecutive months.
So sure. So the again, it was in the FAQ from March 30th on emergency rental assistance payments. In there, it it acknowledges that if someone needs assistance for month 1 and 2, has someone else pay month 3, then they need assistance again for month 4, that it is allowable for CDBG-CV to be used for months 1, 2, skip 3, and pay month 4. What it's based on, that funds need to be necessary, the payments need to be necessary. And if someone already has a payment being made for month number 3, they don't need it from CDBG-CV. So as a result, you can go month 1, 2, skip a month, then pay 4 and 5. The consecutive month comes in as your eligibility is 6 consecutive months. So you can make payments anytime during those 6 consecutive months. There can be a gap where CDBG-CV is not needed, and that doesn't mess us up.
Yeah, thanks, Dan. I think that was a really important clarification that I don't know that we knew before this recent FAQ. So thank you.
Right. Yeah, and the FAQ will explain it much better than I just did.
All right. I'm about to transition with a second question, but there's first 2 simple ones. One is internet access considered a utility payment?
If you're providing financial assistance to an eligible beneficiary so that they can pay for the service, then yes, that's an eligible utility payment. Stan mentioned several options where the local government might work with a provider to expand facilities or provide more equipment via the buses or public facilities. So it could be eligible that way under public facility, but yes, it would be an eligible utility if it's under subsistence payment going directly to the households.
Thank you. And then this is related to one of the examples provided. In the broadband Escambia County, Florida example, is the county paying for the monthly service bill, and do they plan to pay for this service indefinitely?
Not indefinitely, and yes, they're the ones that they're paying for the service at the parks. You know what? I shouldn't be so quick to say not indefinitely. I have to double check. I didn't think. My initial thought is they weren't planning on doing it indefinitely. Probably going to do it till the CARES Act money runs out.
Thank you. Now this is transitioning. We've been talking a little about utility payments, and then there's some other questions coming in about shelters. So this question here is, what about utilities for a homeless shelter? Does the 6-month consecutive payment rule apply?
No, that's shelter operations, is specifically public service being offered by presumably a subrecipient or the grantee themselves. So it's not subject to the subsistence payment limit of 6 months.
Okay. So we have some shelter questions then. Can the funds, can CDBG-CV funds help with the startup of a private shelter, especially if the shelter was created to solve mental health and unshelter the homeless issues?
So again, you're probably going to offer the funding through one of 2 national objectives in eligible use, one being the public facility. So if it's a public facility, then the agency that are developing the shelter would need to be an eligible nonprofit, and therefore as a subrecipient. Likewise, if the funds, CDBG funds were provided as for operations, then it's going to fall under shelter operations, which is subject to the public service cap. I know we don't have a public service cap here, but it's subject to public service requirements otherwise. So the answer is yes. You used the term private. I'm going to assume that means private nonprofit. As a side note, you would want to encourage that shelter to be active in the continuum of care and hopefully utilize low barrier shelter protocols.
Okay. So you have one that just came in. Let's see. Sorry. Okay. We have some about rehab. Jump back a little bit. And specifically related to UVC technology. I'm not sure if you're as familiar with that. Can you pay for proven UVC technology upgrades to mitigate pathogen spread in areas where people gather, like community areas, restrooms, working spaces, schools?
Right. So I think they're referring to the UVGI, which is that ultraviolet germ irradiation technology. And that's used, as historically been used a lot in medical facilities too, because they have been historically the only ones that have really focused on transmission of respiratory illnesses. And so, yeah, those kind of upgrades to an HVAC system would be something that is allowable. We're starting to see folks doing in public facilities and considering public facilities. And there is an upcoming economic development webinar that's going to talk to about doing it for businesses as well. So there's that. There's HEPA filters. There's also indications that, or research that shows that the virus is less transmissible when it's between 40 and 60% humidity. So folks are working on HVAC systems as well that also reduce humidity to that level. So all those things would be considered CDBG-CV eligible, and certainly there's tieback.
Okay, great, thank you. Another question is, can a housing rehab be used as a grant rather than a forgivable loan to a community that covers the eligible costs for an LMI home? And can the program be used for rental homes occupied by LMI persons?
So sure, it can be a rental. The challenge with doing some repairs as a grant with zero recapture is that someone could get their home repaired and then flip it as soon as the repairs are done and walk away with the cash. So usually they're done as a forgivable loan, where if someone sells within a certain time frame, they would have to repay the assistance. Now, Eric, can we have anything else you want to?
No, that's perfect.
Okay.
All right. Another question come through. If the first payment made on behalf of an individual for utility is 3 months past due, can we still pay for the following 5 months of the same utility?
Correct. That is a true statement, and that is in the March 30th FAQ on the HUD Exchange. It explicitly explains that.
Okay. And it looks like we have about 1 minute left. Is that right? Do you guys want to take a few more questions or just finish up the presentation?
I'm happy to take additional questions. I know there's other sessions starting momentarily. I'll just add that the presentation will be made available on the HUD Exchange, and you can see our last couple of slides here are several links. Because there were so many questions about the LMI tool before mapping tool, before we post this, I'll add a quick slide at the end and provide that link. I was trying to send it to people in the Q&A as fast as possible, but we'll make sure that that's available here on this last slide, quick resources page.
Yeah. Questions do come in quick.
Yes, ma'am. And just a final point, you can find that LMI mapping tool and all the database stuff on the HUD Exchange. So if you go to the HUD Exchange and then just do a quick search, LMI mapping application, you'll link to it as well. And there's a quick YouTube video that'll walk you through how to do it. I see a lot of questions on that one.
Mhm. All right, so we'll continue with some questions. We've got another one for housing rehab. Can the housing rehab be a grant to a community that covers the eligible costs for the LMI home? And can this be used for rental homes occupied by LMI persons?
I think that's the one we just answered.
I
So
think it is.
yes,
It's just a
Brent, yeah.
different version. As soon as I read it, I
Oh, okay.
realized that, like, sounds very similar. One more, does FMR apply to CDBG-CV?
It does not. Usually the way people handle rent, kind of a reasonableness is by limiting the amount of assistance that they'll provide in total. So if someone was in a $5,000 a month apartment, they might not, and were somehow income eligible, they would not usually qualify for, for 6 months, $30,000 worth of assistance. So it's usually limited that way, but FMR is not a CDBG requirement.
Okay. Here is a question related to the connection with CDBG-CV and ESG. Can CDBG-CV be represented in reporting for rental assistance clients in the HMIS client track system? Now this crosses the programs, but I'm curious if you have a response.
Yes, so any program that is using a combination of ESG and CDBG, then yes, the beneficiaries would have to be reported in the HMIS for ESG requirements, and then as well in CDBG for our CDBG reporting requirements. Absolutely.
Okay. And are we at time, or do we have?
I think we are at 10:32. We're ending at 10:30.
Yeah.
Okay.
There's still a few more questions, but we can work to answer those offline somehow or another.
Okay.
Together and respond in a collaborative fashion.
And
right.
One last point before we close, for those of you that may still have more nuanced questions that we're not able to get to this morning, please feel free to use the Ask a Question resource also on the HUD Exchange. Stan and I are reviewers there. There's lots of reviewers that will respond to your question, and we're typically able to respond to those questions within 48 hours. So again, if you were not able to get your specific question answered this morning, please feel free to submit a question there. Ask a question on the HUD Exchange. And with that, we'll go ahead and close out. Thank you, Diane, for helping facilitate with us this morning, and Mario, and for all of our other HUD representatives that tuned in. Thank you, everyone, and have a great day.